So welcome everybody. I'm here today with my good friend, longtime friend, Dr. John Nosti. And I see you're wearing your Rock the Drill t-shirt from the Clinical Mastery series. That's awesome.
Always.
That's
Good
awesome.
to see you, Greg. How have you been, bro?
I've been good. You know, I think we're all doing the same thing, right? We're all kind of focusing on retooling and re-educating, right?
Absolutely.
Yeah.
It's a great opportunity for that.
Glad to see that you and yours are all healthy and safe, and you know,
Same here.
Yeah, exactly. One of the things I wanted to talk to you about was, you know, we know that everybody is not everybody. I mean, some people are really just kind of kicking back and taking this as downtime. And with everything that you do, whether it's your private practice or clinical mastery or your gym ownership, and I mean, you are one of those guys that never slows down and never, you know, you're always working and always hustling. And to me, that's really inspiring. I love watching that. And in fact, I wanted to let you know you've helped me lose 27 pounds since Christmas. So,
nice. I think you look great, man.
Yeah, thanks. Well, I'm getting there, you know. But with Clinical Mastery Series, you know, everybody now in this downtime where we're all working harder than ever, I know is doing like a lot of continuing education groups, doing some online courses. And I was wondering if you could share what those are, those kind of opportunities for our viewers.
Yeah, so you know, a couple things is like, you know, I've given so far a webinar for the Washington Academy of General Dentistry that you can see for free at their website, and that was a minimal and no prep, you know, veneer webinar. That's a 2-hour continuing education seminar that people can see for free. I'm going to be speaking for New Jersey Academy of General Dentistry, another webinar. We haven't chosen the topic yet, but that's going to be another one that's going to be up and coming. So people can hit me up and I'll let you know when that's going to happen. Dental Town's going to be launching a new course of mine. And I believe Dental Town still operates where you can watch it for free, but if you want the hours, you pay $36 for 2 hours of continuing education. And that's going to be, yeah, good deal.
Yeah.
Yeah, so, and that new one is going to be on treatment planning and restoring implants in the aesthetic zone. So those are a couple ones. And then, you know, for docs who are interested in clinical mastery, you know, we do have online.clinicalmastery.com, and we have our Occlusion 1, our Occlusion 2 courses, and we have anterior aesthetics and photography. So we have those 4 courses on there. Obviously, you're at home, so you don't get the hands-on portions, but you get basically the nuts and bolts of our Occlusion 1, Occlusion 2, anterior aesthetic over-the-shoulder course, and photography. Get the nuts and bolts of that. So
well, and I don't know this, and I'm not trying to put words in Clinical Mastery's mouth, but I'm sure that after everything opens up, that if they've taken those courses, that there'll be some sort of consideration for being able to come and get that hands-on at a later date.
Oh, 100%. So I know, I mean, I'm not the one in control of the dollar amounts that
Right.
happens. You go online and then come take the course live. There's definitely a discount.
Yeah. Well, I mean, again, I'm not trying to, you know, the management power at Clinical Mastery might get mad at me, but I think that's really what everyone's doing. You know, for example, with us, not traveling, you know, we've got Nate and Mark and myself and our clinical integration specialist, Brent Thompson. We've been really busy doing trainings with people, you know, logging into their computer in their office and going through and honing how they're taking, you know, JVA, EMG, jaw tracking, going through laser, going through basically everything that we've got. And it's really exciting to see people gearing up and getting ready to go forward, you know?
Yeah, I mean, this is a great time. I mean, you know, we talked a little bit earlier about it. It's like, you know, for me, I you know, you have to look at everything positive. You know, this is something that's out of our control. So you have to focus on what you can control. And to me, this is like a 1.5, 2-month vacation that I never would have scheduled for myself, right? So, and you just got to take these opportunities to, better yourself personally, better yourself professionally, and there's really no excuse. I mean, docs who I know who have, purchased the equipment, and it's great. You get JVA, you get jaw tracking, what T-scan, whatever it is that docs have. I mean, if they felt like good, but not like there are super, strong at reading everything. I mean, this is a great opportunity to excel and really get the grasp of how to do electronic diagnostics in your practice. Because when you're going to come back, you're going to be a rock star, and it's going to allow you to do more higher end dentistry, just do more dentistry, period. I mean, I've said that from the front of the room, time and time again. And this is a great opportunity. You really have no excuse. I mean,
that reminds me, in 2018, you spoke at our annual conference here in Milwaukee on treating the TMJ, and it was teeth, muscles, joints in the general practice. And we actually have that entire presentation on our website at bioresearchinc.com. And we'll have a link to that here, and I'll send that to you as well, John.
Awesome.
But we've opened up all the annual conferences, but your presentation was unique in that you're not a full mouth reconstruction guy. You're not just the general dentist. You're not a TMD craniofacial pain focused doc. You do all of that incorporated in a congruent philosophy that you've developed over years and years. I mean, you and I have worked together for a very long time, and I was wondering if you could speak to not just that lecture, because you cover it quite well in that lecture, and our viewers will be able to see that, but how do you incorporate this into your practice to set yourself apart in Mays Landing?
Man, that's an awesome question, Greg, and it's one of my favorites because just as you said it, man, I think so many people look at it like, well, I can't just do the aesthetics in my area. I will never be able to survive just promoting myself as a cosmetic dentistry only guy. And I don't want to just focus on TMD. Some people say that, like, I don't want to just selectorize and only do TMD because I still like general dentistry. So, how I separate myself, even in this, I would say somewhat in the state of New Jersey, is, having the BioPack information and having that technology in your practice. It's great because you can select, when and why you're going to use it. So first of all, I mean, in my office since about 2002, we've done JVAs on all new patients. And it's super easy for, as your assistant, takes the FMX, my assistant takes photos, and my assistant takes the JVA. So I can operate in an insurance-based general dentistry practice where having two assistants, that new patient comes in and they're coming in 45 minutes before I see them for my assistant to gather all that information. And then when I come in, I can have half hour, 45 minutes of time on my personal schedule. And now I'm doing a complete exam, but really that is like an hour and a half long procedure, but it's only half hour, 45 minutes of my time. So now I can go in there, I can look at their photos, I can look at their JVA, and I get that for all the patients. And the best part about it is, patients who I'm going to see some significant things on, we can then invite them back and then do more records, which would include the full BioPack. But, we don't need the full BioPack on everyone. So, it's important to understand, you get some information on all of your patients. And then from that, you can then triage them. Is this someone who needs the full BioPack? Is this someone who needs, some other complete dentistry that we're going to do?
Right.
And likewise, the other part about it is cool is I having the full BioPack, I can selectorize it down to just doing one component if I choose.
Right.
Or, when patients come in or they're calling up and they have a TMD problem, those patients are starting out right from the get-go with the full BioPack. So,
well, and I think that's something that's important for all of our clients and for dentists out there, all dentists to realize is that in addition from our perspective, right, bio has never promoted any particular treatment philosophy. What we do is we create diagnostic aids, right? Measurement tools that give you more information about how a component of the patient is functioning. And so we'll have doctors that come at it from a joint perspective, from a muscle perspective, from a psychological perspective, and be able to see how the physiology is responding. And what you're doing with your initial workup is you're just getting a more comprehensive view of the patient's function today. And then you, in our conversations, you plan, okay, this is what I think going forward, and you can check and see just as you do with your x-rays, just as you do with a visual analog scale. How does that feel today on a scale of 1 to 10? You know what I mean? It fleshes out the information for you.
Yeah, and you know, don't get me wrong, like on our initial exam, and we're doing muscle palpation on our initial exam, so you're going to uncover if the muscles are a problem as well. But just we look at it in terms of, you know, you can push on a patient and a patient realizes, yeah, that does hurt. But you know, I mean, so many patients have a click and they don't even know they have a click. So to me, that's why it's super important to get the JVA, you know, on their initial exam. I mean, even if you get a protective appliance out of it, you know, because the patient's not ready to accept treatment, I mean, that alone is still going to, you know, increase your productivity in your practice.
Yeah, the number of times that I have, and this is dentists, that I've been taking a joint vibration analysis, and I'll measure range of motion, and do you have a click on either side or grinding? No. And then you record it, and they clearly do. And the first thing they say is, well, yeah, when I open wide like that.
Yeah.
It's like, what, you function between 20 millimeters your whole life? Well, yeah, because otherwise I click. But you told me you didn't. You know what I mean? So, and that's dentists, you know.
Absolutely. I mean, you know, not to continue that subject, but that's one of my favorite things about teaching UO1 is when, you know, we have a group of doctors in the room, or even if I'm speaking at a conference somewhere on one day and there's 300 docs in the room, and I have everybody put their fingers in their ears and open and close, and all of a sudden they feel they click. It's amazing. It's almost like for the next 10 minutes, as my presentation continues, you can tell for definitely a significant percentage. Sorry, it's my dog.
That's beautiful.
Definitely for his name is Max. We rescued him. He's a 3-year-old white German Shepherd that we rescued.
Beautiful.
So, you know, at traveling, you know, you need to have you know, a presence in the house, and he definitely, when the doorbell rings, it's not a house that you want to come in if you're hearing him bark. But getting back to, you know, it's really funny is, you know, when I have doctors do that, put their fingers in the ears, and all of a sudden you tell that they uncovered something that they didn't realize they had. It's funny to see a percentage, and it's a significant percentage, at least 10-20% of the docs in the room who didn't know they click. For the next 10 minutes, I become like the peanuts teacher in my lecture. They are not paying attention to anything I'm saying. They're just like, I can't believe I clicked. The look on their face just whites out.
Well, and what we've done is at the Clinical Mastery Series UO1 is we'll take a JVA, just sit down and take a JVA on everybody in the room. And it's interesting that of doctors, you know, we've got 35 to 40% have some sort of vibration coming from their temporomandibular joint. And when you look at general dentistry, third molar extractions, crowns, I mean, I'm not talking TMD or full mouth reconstruction. That's the skeletal foundation that your general patient population is doing. You know, so that's why we always encourage people to do exactly as you do, which is just do a quick screening on everybody, because it brings up the conversation about how is the joint functioning, how is the, you know, and that is not necessarily to say that everybody who has a click has to be treated, because I know you don't believe that, right?
Yeah, not everybody needs a full-blown treatment, but they should. I mean, even if they have some click, they should have something done. And just like I said, whether or not it's just a protective appliance, they should have that. They should have something. It might not be, a full-blown TMD treatment, but it's definitely some type of treatment.
Well, in any joint that isn't functioning normally, that's the case. I mean, that's the reason for, orthopedic shoes, and take care of your back and keep your core strong, your entire spinal column. I mean, all the joints in the body are subject to degeneration and breakdown.
Right. I mean, it's quite simply, in my practice, the JVA opens the conversation of, why do I have this? Maybe how do I have this? What's causing it? And then what do I need to do to prevent it from getting worse? Just that, having that information, the patients themselves now start asking those questions. And when the patients are asking those questions, that definitely opens up your conversation better. I mean, that's what we want.
Right.
It opens up the door for more treatment. You want patients coming in. Why are my teeth yellow? How can I get them whiter? Why are my teeth worn down? That's great when a patient asks that versus you having to say, hey, you know how badly your teeth are worn?
Yeah.
It's just a huge aid in that.
So, John, let me ask you, as we're wrapping up here, what are you doing for courses? I know that, we've talked about the courses you're doing online, courses we have online, CMS's courses online. Do you have an idea or a plan as far as when you're going to be back out lecturing and traveling again? I mean, I know it's obviously waiting on the states and the governors and the president and everything like that, but I mean, what courses do you have coming up this summer? July, August, you got things coming, or?
Yeah, man, we got the whole schedule still to pick back up again with advanced treatment planning. Our TMD course in Nashville got canceled, so we're going to be doing that towards the end of the year. I give 2 over-the-shoulder reconstruction courses every year, or in the op reconstruction courses, where doctors come watch me do a full mouth reconstruction. We did the first weekend of that right before, right as COVID was kind of hitting.
Right.
We did the prep weekend, so my patients and temps, and we have to do seat weekend, which that looks like it's going to be June.
Okay.
And then we have occlusion 3 that we had scheduled for May. That looks like that we're hoping to still get that done towards the end of May, but we're really going to have to see how everything unfolds. So to answer your question, we're hoping by the end of May to get things back up and rolling. I wouldn't be surprised if it's not until June.
Is it clinicalmastery.com though, is where people can check that out and see when these courses are coming and rolling forward?
Absolutely. Clinicalmastery.com is the website that goes over all of our continuing education seminars, and our online platform to see our courses online. It's just put online.clinicalmastery.com.
Perfect. John, thank you very much for your time and for your friendship all these years. I really appreciate you. I love surrounding myself with people like you, because you always inspire me and drive me to be better. So I appreciate it. Thanks, buddy.
Same here, brother. I appreciate what you guys are doing for people.
Well, be safe and wash your hands.
Yeah, you too.